this morning, like I said, my guest is the registrar of the Liberia Board for Nursing and Midwifery, Madam Cecilia Kwangbala Flomo. Also joining her is the head of RT at the Board for Nursing and Midwifery, Jipley Williams. But Madam Flomo, I'd like to say good morning to you.
Good morning.
And Mr. Williams, just knock that. Yes.
Um,
How are you?
Good morning.
Great. Let me start with you. How's the board, Madam Flomo?
Yes, the Liberian Board for Nursing and Midwifery is going very good.
Okay.
Quite busy, but very impactful.
Busy with what?
Too many things. Regulatory activities,
Mm.
policies, processes, procedure, engagements with our stakeholders and so forth.
Okay. So if you want to make one understand what the board does, the mandate in essence, whether it was established by an act of legislation, what will you say? What do you do?
Exactly, Mr. Kamara. Thank you for answering the question. The board was actually established as far back as 1948.
Mm-hmm.
And it was passed into law within the foreign year, which is 1949,
Mm-hmm.
and with a legal responsibility to regulate nursing and midwifery education and practice in the Republic of Liberia.
Mm.
And since then, that is what we do.
But are you under the Ministry of Health as per what you do?
We are an autonomous agency.
Okay.
We are within the health sector, yes, but we are an autonomous agency instituted by law.
Mm. And so who are your immediate stakeholders? Is it students of nursing or administrators of nursing schools?
So as our legal mandate instructs,
Mm-hmm.
we are responsible for accrediting, approving, working with nursing and midwifery schools, programs, or institutions. Whether you are offering basic,
Mm-hmm.
basic means you take students from high school who meet the requirement to enroll into your institution, or nurses who are already licensed,
Mm-hmm.
but you want to improve or offer them, or they want to have specialty.
Mm-hmm.
So the law requires that we are responsible to approve such programs, basic and or post-basic programs. And because we are responsible, that definitely puts us in line with nursing and midwifery institutions. I usually tell people we partner with them.
Mm.
So from the administration down, because when we come to monitor, or when we come for regulatory activities
Mm.
that will lead you to offering nursing program, we deal with the entire institution.
Mm-hmm.
So we start from them.
Inclusive of the administration and the students.
Yes, when there is no administration, there is no school, Mr. Kamara.
Yeah.
So we deal with the administration. We
Mm.
just don't deal with the administration. The administration tells us that we've done X, we've done Z, and we've done Y.
Mm.
So we actually look at 4 pillars into our accreditation processes. One has to do with management, administration.
Okay.
That includes the entire institutional ability to offer the program for which we will approve.
Mm-hmm.
The next has to do with classroom and how classroom is administered. So we call it classroom and administration. When there is no classroom, you know there is no school.
Mm-hmm.
So that's a primary area nursing board looks at when we get out there for our regulatory assessment that leads to approval or accreditation. Of course, infrastructure.
Mm-hmm.
Badly. If you want to run a school, the physical infrastructure, the environment where the students will learn on a very conducive environment is key.
Mm.
And nursing board considers that very highly.
Mm.
And then, of course, you come to what you call the clinical. There is no nursing education without clinical education, because nursing is hands-on.
Mm.
You just don't do theoretical like an accountant, even though every subject area has a practical, but this one is required. So we want to know, where are you taking these students to learn the hands-on? So those are the 3 pillars we emphasize very strongly honor our regulatory assessment, leading to either recognition, approval, or an accreditation.
That is, as I understand it, that is for nursing. That is for the practice of nursing. What about the practice of midwifery?
Sorry, whenever you see us,
Mhm.
think about nursing and midwifery. And thank you for correcting me, because I know a midwife out there is
Will be
thinking that
thinking-
what's happening with Mistress Flumbo. So as the name,
Mm.
as you hear the name, the Liberian Board for Nursing and Midwifery.
Yep.
So let's consider going forward into this discussion. Whenever you hear nursing, is all talking about midwifery. However, I will do everything to say nursing and midwifery, or nurses and midwives.
Yeah,
Thank
but
you.
both of your responsibilities are shifted towards the practice, essentially the practice of nursing.
Both.
Yeah.
The law requires that I legally monitor or regulate nursing, education, and practice.
Okay.
And that is why our mission is to ensure that those who practice
Mm.
on our population practice on a safe, competent, but have the professional entitlement
Mhm.
to go into that practice. So our mission is to protect the public's health, but through ensuring that people who practice on the public are equipped, and the practice is done through safe and competent means.
Mhm.
And that requires that our responsibility comes equally with education and practice.
Okay. So, for example, I want to set up or establish a nursing school. Where do I start from? I have the building. I have the infrastructure.
So, Vavde, that's why we are here this morning to talk briefly about the policy, the process, and the procedure of the entire accreditation processes. Accreditation is not an event, it's a process.
Mm.
Sometimes people misunderstand and think that it's an event or it's something that you can put in for and get right away. But the accreditation is guided, number one, by law, which is the Act of the Liberian Board for Nursing and Midwifery. No one can break that law. And then it comes down to the policy, because the law requires that the Liberian Board for Nursing and Midwifery sets standards, procedures, and guidelines that will support the regulatory implementations.
Okay.
So then we have a policy on accreditation.
Okay.
And that policy
It's a set rules, right?
is a set rule. That policy presents the processes and the procedure and where to start from. You first start with an application, and you will see the policy on our website. That application explains to us on why you want to start this venture of training nurses and or midwives. And when you send us that application, we then ask you further, what's your strategic plan? What are you thinking within the next 5 years? You know, all of our policies, our policy document requires that we move within 5 years, because things change over the period at least of 5 years. So we want to know from you, within the next 5 years, what will you be doing to support what you are thinking about? And what's the gap you think that you want to close? Do you want to open a nursing school in your community? Okay, what do you see that you want to support the Liberian government with producing nurses and midwives? What the data you want to change, or what are those gaps you want to close? You will eventually tell us, and you also present to us your sustainability plan. We just do not want you open today and tomorrow you are no more, because you are training, or you will train professional for life. And these people will carry your name. For example, you graduated from the school today and you travel out of Liberia, they are sending back to me to ask, which school have they graduated from? Was it accredited? Is it still current? Is it in line with the law of the Republic of Liberia? So we do not want people graduating our nurses and midwives just for a year. And after that year, we will now start to say that school is no more. So you gave us your sustainability plan, your faculty recruitment processes. To train nurses and midwives, you have to be a trained nurse midwife educator. Do you have one? Are you willing to sustain and support one? And then, of course, what is your clinical plan? You have one hospital within the environment. You already have 5 schools going to that hospital for clinical purposes, for rotation and internship. Do you want to use that same hospital? Does the hospital have the capacity to train more people, including your institution? So we ask you these questions, and then you now will have to address them one by one. And if it falls in line with the guideline, then we proceed to the next step.
Which is next step, which is
the physical validation, which is the assessment.
So you go there.
Oh, yes.
Okay.
We have a policy, and right now we are also revising and validating the policy. I think last week you interacted with our guests. We usually do peer review, regulatory peer review, because we want to actually think globally, but act locally. So most often we try to get out there for best practice, either by visiting or welcoming our colleagues. So the team you saw last week before last, came from Kenya Nursing Council. And if you did your research, they are one of the outstanding in the region. Okay. So they are currently supporting us in revising our current accreditation guideline. Okay. But like your question, the guideline requires that we do peer review of your process. So the assessment team is made of schools that have been accredited, that have maintained standards over the years, at least 5 to 10 years. And we get...
Why do you include them? Why not just the board go there and carry and does the assessment and come back and do the report?
So the organization of the board is made of schools and hospitals. So that's the board. Oh, okay. Members of schools and hospitals that meet the guideline to sit on the board. The bylaws of the board requires that those people made up the board. However, best practice shows that peer review process, Vabdi, is very good. I think you are testament to that. When you speak to your colleague who is in the right path, who carries on best practice, you are sure to learn from them more. So the policy or the procedure of the board requires that people who run school know the challenges, knows the best practice. We do have very good schools in Liberia. So members or administrators of those schools will join us. We also want the school to know that it's not just about the board's procedure, because somebody will say, oh, the board didn't do this, they didn't do that. But your colleague is sitting there who runs a school tells you that, no, this is not about the board. This is about standard. This is about producing qualified midwife. This is about producing qualified nurse. Globally, regionally, this is how it works. So while the board is speaking, your colleague is there validating what the board talks about. So that's the peer review we carry out with the accreditation processes.
Okay, you go there, you do your assessment, you come back with the funding, you put it together. What's the next step? Is it the last step to accreditation?
Yes. So that step requires
when you satisfied with what you've seen on the ground.
Yes.
You accredit them.
The current policy requires that you score 80 and above to be fully accredited and functional as a new school. And like I told you, those 4 pillars or 4 areas or 4 levels will be assessed. There are different areas, questions that will be asked. We call it verification criteria. So when you meet those and hit 80 marks, we give you your accreditation, and that goes for 3 years.
So every 3 years you have to go back to the board and renew.
Every year the board does what we call quality assurance.
Okay.
However, you are right. After 3 years, within the last year, which is the last 6 months for your last year to end your last 3 years, we start your accreditation process. This comes as we did 3 years ago, because we have to validate the sustainability of everything that you said you had when we came there 3 years ago. Because standards, it appreciates and depreciates. So if you do not maintain and sustain standards, it drops.
Okay.
And the fear of the board is whenever your standard drops, the quality you produce
Mm.
will have issue. And we all want the best nurses and midwives to
Mm.
come from Liberia, because you know nurses and midwives are the lifeline of the health system of the Republic of Liberia. We are the largest, and most often where you see us is where lives are saved on the clinical fronts. The clinical levels, if you do not see us in other places, administrative, we are at the clinical areas. And you know, at the clinical areas, there where lives are saved. There where that pregnant woman meets a midwife. And that midwife must be qualified to take care of that woman. ICM, International Confederation of Midwife, midwife requires that a midwife should be qualified to care for a woman during pregnancy, delivery, and after. And where do you produce that? It's at the school.
Mm.
And how it goes, when nursing board accredits you and say, yes, you are qualified to do this.
Is that a reason why your process is rigorous to ensure that competence comes out of these schools, these students? And say, for example, how long will it take you to carry on the process and accredit, and for a school to operate? How long? I ask the question because people have been saying there is this proliferation of more nursing schools. So if your process is very rigorous, time consuming, because you want to ensure that the right things are done, then why are schools popping up in frequency?
And that is why we are here.
Mm.
Because not all schools you see is qualified for your training.
Mm.
Most of them are illegal. And that's why the board fights every day. And one of our measures is to come and inform the population on where to go.
Mm.
When you visit our website, we have the accredited, approved schools, the region for which they are located, and the credential they offer.
Mm.
So you are right. We are rigorous because we are instituted by law. Anything less than what the law instructs, you know that you and I will be at fault.
Mm.
1. 2, we are talking about people who will take care of lives. So if we do not put in processes, procedures, policy that guide the production, I usually tell people the nursing and midwifery schools are the factory for producing the human mechanics.
Mm.
And because they are the majority, they are on the clinical front line. Right now, when you visit JFK at the emergency ward, majority service provider you will find there will be nurses.
Mm.
When you visit a delivery ward, the ANC, majority service provider you will see there as we speak will be midwives. So if these midwives are not produced in a proper manner, within a well-qualified, standardized, per global, regional, and local requirement institution, we are heading for trouble, Fafi. You can imagine what will happen to us.
Mm. So how long does it take for you to credit a school?
The board doesn't like to attach timeline to these activities
Mm.
because they are quality assurance activities, and it also lies in the institution's ability to produce the requirement. If you can produce an infrastructure with about 5 to 6 classrooms, a well set up skill lab that mimics hospital, and have trained teachers who are your full time that you can point out and say, this is our psychiatric expert, medical surgical expert, pediatrics expert,
Mm.
tropical and communicable disease expert, obstetric gynecology expert. These are our nurse midwives educators that we have prepared to deliver to the public. And then you come down to show us a hospital, 40-bed hospital with equipment, with accurate patient load that will be able to take the patient and the cases for which you have agreed to offer, you can now say you can be accredited to run a school. So we do not like to attach time, because you can do those within the next 10 years. You can do it within the next 15 years. Maybe after you can start thinking about opening school within the next 30 years. So if you approach the board, it lies with you, your capacity to produce these things. So if we told you 1 year, if you can, fine, we are available. The policies are there. The standards are on the
I was
website.
just thinking about a week.
No,
Even on a normal situation, you can accredit for a week.
no, you can't. Can you produce what I've just named for a week? The criteria that I just named, the guidelines, you cannot produce it within a week. So you have to take time. You have to plan. So we tell people, opening a nursing and midwifery school is not an event. It's a process. You have to think it through, because you are producing people that will take care of your very self tomorrow. What do you put in is what comes out. And all nursing board requires is quality. You put in quality, you receive quality. So they have a lot of issue, but that is what. Of course, the ones that come out and not following the procedure, they are not in our database. Remember, we've done a lot of reform as we speak. Nurses and midwives trained for Liberia are recognized anywhere in the world. We do a lot of verification, international verification. And the first question they want you to answer is, did this person graduate from an accredited school? And was the school even accredited when they last graduated? Is it current? Tell us the first accreditation date. Tell us the last current date. So the first start, your verification starts with your school. It comes down to you. So that's how the accreditation works. And by law, if you came from an illegal school, you are not employed anywhere in Liberia. Because if they ask you for your license. If you gave out license, they send to us for verification. So we've identified a couple of people like that who present fake licenses for scholarship purposes, for payroll, for employment. Of course, we send back and say, this person is not in our database. This is fake. So your whole career or your life you are running for is just stopped just by one click of button for verifying that you came from an illegal establishment.
As per what is on the website and what you have in your database, how many schools, nursing and midwifery schools in Liberia, how many are they qualified, up to date?
23 of those.
23.
You have one in Meridian Harper, that Totman University.
Okay.
You have one in Grand Jide Zwerju, that is Diana K. Assistant School of Midwifery. You have like 2 in Nima, that Nima County Community College, and then you have Winifred J. Hardy, which is the United Methodist University. You have 2 in Bond County, Phoebe Hospital, Phoebe College of Health Sciences, and then Cottington University. You have one in Zolzer, Esther Bacon College of Health Sciences. You have 2 in Vanjama, Rue Brownstone is private, and you have the Lofa County Community College. And then the rest, you have one in Mike Gibby, Cottington Junior College. You have one in Grand Bassa Community College. And then now you come to Mosul.
So in the whole Grand Bassa, 1?
Yes, 1.
And anything other than that 1 is fake?
It's completely illegal, fake. And those people should be arrested by the law. Mosurado, you have one right beside you here. That's the Morovia, maybe Macon College of Health Sciences, Morovia Bio College. But then you have Advantage University of West Africa. You also have Malapaten College of Health Sciences. You have SMART. You have, help me before we fall into trouble.
You don't have to name up.
Yes, you have Nakita Midwifery. You have Totman National Institute of Medical Arts. Of course.
Yeah.
Yes.
So 20,
but they are on the website, and you can just call. You can get all of those.
Okay. So 23. What would be your?
You also have the New Side Eye Center. They offer exclusively specialized program, which is ophthalmic nursing. You have Duja that offers nursing, and these schools are many. They are also approved to offer certain nursing and or midwifery program. Probably the interesting thing we need to note here is If you apply, you are only going to be processed for one at a time. You also have the ULBSC midwifery program. And that one, you will have to show and prove that you have the capacity before you can apply to add or modify your program. Modification comes in where you were approved to do an AA. Now you say, I have the capacity to do BSc, or I want to offer master in nursing education. So these schools we just named, some offered AA, some diploma, some masters, some only midwifery, some only nursing, some nursing and midwifery, some basic and post basic. So it's unique, but you will find all of those in our database.
Your critics say that you are aware of the establishment of these illegal schools. You know they exist. I don't know if you know where they exist, but you haven't set up a task force to weed them out. What do you say to that?
I was keeping that for the challenges I face, but maybe we could discuss it as we go by. They are right. We are aware that they are illegal establishments. We do have documentation of letters written to some of these people with our legal counsel consent and involvement. Being aware is different from approval. We do reject them, and every day whenever we appear in public spaces, we inform the population, support LBNN to support you. Do not send your children, your wives, your fathers. Do not support the illegal establishment. We've done task force. We meet these people. We write them. Rather, if you visited my office at the nursing midwifery school department, you will see a couple of letters to people asking them to shut down what they have started. Some even open before writing us, and that's the wrong step. Our policy requires that when you are illegal and you start to operate, when you write us, we tell you that we cannot deal with an illegal establishment. Our involvement with you to start a nursing and a midwifery program while you have opened and fooled the public and illegally established is wrong.
Is it not possible to get the security apparatus involved?
All of these collaborations are possible. When it comes to the law, there is no one higher than the law. So all of these collaborations, whether the security, whether justice, whether the lawyer, whether the sector, all of these are possible. One of the things that is so challenging has to do with they are all illegal establishment. People opening places and calling it nurse aid schools. Our law requires nurse aiders to aid the nurses and midwives in the hospital, but it doesn't require you opening a structure. They must learn under the nurses, and they are only required to do certain things. Anything that a nurse, higher education permits a nurse to perform, nurse aiders are not. But people open this establishment because of money and put people in and get them out. And like you see, when they are out, everyone calls them nurses and midwives. So those are challenges that we all have to partner the health sector, the journalists, the justice, to make sure we ensure that these people do not proceed, because that's wrong for our population, because it may be your child that may fall right in their hands, and any mistake in nursing and or midwifery application is no more. It causes permanent disability.
I remember you arrested a situation in Ganta where a nurse walked on the eyes of a child and squarely damaged the eyes.
Exactly. Thank you. You can remember. Those are things we do. The regulation calls for that, because if we need to protect the public's health, we need to go anywhere to protect them. And just what you are saying, these are things we want to prevent. Okay. And that prevention comes in with starting with a vibrant accreditation policy.
Okay. Let's talk digital reforms. I guess where GPLA will come in. Digital reforms. Where are we with it? I remember you used to do the paper base. You take the test, whether it's Maryland or LOFA. People sit the test on the paper and correct, like the way people take the WAEC or the WAS nowadays. Is it still continuing?
We are no longer in that.
Okay.
The issue about reforms, especially digital reforms at the nursing board, is moving on very well.
Mm.
So you are right. I'm happy that you know a lot about us because you support us a lot. We started giving out tests since 1956.
Mm-hmm.
From there up to 2021, we were giving paper-based. Vavle, the challenge about paper-based, it has its own merits, but the challenges are so many. So then we came down to the reform of how we can change from paper to digitalization. So we started, like I told you, we do peer review.
Mm-hmm.
So our first place we look at towards our neighbor Ghana. They visited us sometimes 2021, the registrar and others. So they supported us and we used their system and tested that digital exam was the way to go.
Mm-hmm.
So immediately the Liberian Board for Nursing and Midwifery approved the reform and asked us at the secretariat and head of the secretariat to look out there to now permanently adopt global standards when it comes to digitalization in regulation. So we used the Ghana system for 1 year. My IT visited there, saw their security protection when it comes to digitalization. And we now started to think, how can we own our own process? How can we build our own process? We had a lot of brainstorming. He supported us. How do we build the frame? Mr. Slomo, this is the security we will put into place. This is it. Of course, we put out there to the world and say, who can help us to build this along with us? And that's how, of course, the board has to approve this before we move forward. And that approval came, and I tell you, frankly, between 2021 and now, we've done a lot of reform at the nursing board. We got our support, our partners, the neoness, who has been very patient with us building the system. And let me tell you how the system starts. It starts from the school.
Okay.
So you see, anything about the school is partnership to us. So the school, when you enter today as a nursing student at the school, you have to pass WIRE and pass the science courses with certain grades. The school reviews all of your document, your admission file, in line with nursing board standard. Remember, Vavle, what we're doing is global, is regional, and we are acting locally. So then that file is reviewed by the school. The school looks at the school's requirement and nursing board requirement. Remember, right after graduation, you are turned over to nursing board and you are with nursing board for life. So when that is done and you are clear with nursing board and the school gives you what we call admission letter. That admission letter, you use that admission letter and sit right in your comfort zone using the link, and then go on the LBNM website or LBNM link, and then send out your application for indexing. So the first place you start dealing with
This
our
is on
digital
the individual basis.
individuals.
It's not institutional anymore.
The institution is part because you have to send us the list.
Okay.
You say Vavle School of Nursing has admitted 10 students with admission letter. These are their names and admission and numbers, ID numbers we call it. Please accept them for their indexing. Immediately, that counts. We put those 10 students in the system and block your school for that semester, for that year. So the 10 students now will come and meet their information. So the 10 student goes and apply, and they pass through our process. They provide their picture and everything. And then when you are approved, the approving processes, then you get what you call your index number for life. So that index number will be now with you until you graduate. If you are AA is 3, BSc 4, Diploma 3. So after that graduation, you use that same index number. This is the digitalization reform. You don't need to come to us in person. Oh, I'm here. I want to register. All of your information are online. You do it at your school's library, where you have internet on your phone, and you call our hotline. They support you and tell you what to do. Eventually, after those 3 years, when you graduate, You remember 3 years ago, Valley School nursing program sent me 10, right? You have to, that 10 remains in my database, right? So we will not take +1 from Valley School because you're supposed to train 10 for 3 years. We will take -1 or 2 because you have drop out during the school's year. People may die, God forbid, during the school year. But we can't take +1 because where the one came from when you didn't index them 3 years ago.
Okay.
So that it shows
and
the
the 3 years have not finished.
The 3 years has finished. Okay. But 3 years ago, you gave us 10.
Yeah.
Then you come after 3 years, you added 2, 12. Where did the 2 come from? It means that they didn't school through the requirement. In fact, if they do not have index number, they won't take the exam. Okay. So they use the index number then and get on the online platform for the national state exam. That makes you a nurse. Graduating from a nursing program doesn't make you a registered nurse in the Republic of Liberia, in the world. So you use your index number and get on the platform, all seamless, and get on the platform and eventually register for your state exam. And you receive all your information right just from registering. And eventually you take your exam using the digital means, either a laptop or a tablet.
Anytime? Is it
No. After there's time. We gave an exam. We gave exams twice a year.
Okay.
So during the registration period, when we open up, then you now register. So what we're seeing is that the indexing is good because it tracks the curricula, nursing and midwifery curricular implementation. Our generic requires that you schooled for at least 3 years to complete our curriculum. So if you cannot school for 3 years, you are not prepared. That's why doing the indexing, you have to index within the first 60 days to show that you enter school and you have completed 3 years. So doing the state board registration,
will you have to present maybe your certificate of graduation or any supporting document?
So after the index, you have to upload your admission letter.
Oh, okay.
It tells us that you are a legal student. Remember, your school is sending the list with your name and your school's number, ID number.
Yeah.
So after then we gave you index number. So that index number carries you for 3 years. So after 3 years, you come to take the exam. We will now see that yes, he entered our system 3 years ago, and now he has completed. So he's qualified because he has completed the processes.
Yeah.
After that, then the system produce your license. Right now, there's a QR code to our licenses roughly.
Okay.
So if you see a nurse, at least a week from now, or anytime you see a nurse and you just say, let me see your license, just use your phone camera and everything about that nurse will appear on your phone. So the issue about people carrying fake licenses all around, when you come from a fake school, you go to get the fake license and claim to be a nurse. The solution now for all of our people, because even when you get to the hospital and you want to confirm that the person who is working on you, your wife, your child, is a nurse from the Liberian Board for Nursing and Midwifery, you just scan their QR code on the license.
Yeah, the detail will pop up.
Detail will pop up. You scan on a gray sheet, detail will pop up. You scan from the certificate, detail will pop up. This is how far we've gone with the digitalization. And then finally, when you become a nurse, you get them put into our profile that we call the nursing profile. Then we connect you with what we call the continuing professional development. So then you remain for life. Then you get renewal. When you are above the renew, you should be doing like 56 CEUs for at least 24 months. That's the time you're supposed to come.
What is the CEU?
It's the continuing education unit from the CPD.
Oh, okay.
So before you renew your license, every profession requires that you do some update.
Okay.
And that update requires you getting a unit. So the board requires that you get that unit within 24 months before your license ends, because we gave our license for 2 years. So when you're ready to renew, you go back to that system, you put in your details, you upload your license, you get your invoice, you pay and get out your license. But before that, then we link you, you upload the information about how many CEUs you generated, and our system has it. So if our system determines that you did less than that, you will be rejected for that renewal.
Wow.
Yeah.
Very rigorous. Talking about reform, digital reforms. Let me come to you, Jiple. I mean, you've been silent. Your body been talking.
Yeah.
Yeah, but I mean, how far are we, and how important it is in the first place to digitize the entire system at the board? Somebody with IT background, with the knowledge, and how has it been helpful?
Okay. Thank you very much. I think you heard what my boss said from the beginning, giving the background of
Yeah, maybe you want to press the red button there. Okay.
the nursing board. So there's no institution survive without the use of ICT as we are in the 21st century.
Mm-hmm.
So the nursing board is now integrating ICT into into their mandate. They have a mandate to issue license to accredit schools and monitor the schools. You ask a question, there are a lot of schools coming up gradually, considering the population we have is growing gradually.
Mm-hmm.
So who knows for the next 3 years, and then our population will be up to 8 to 9 million persons. And the more the population is moving up, you see more social services coming out for people to enroll to those institutions. And the nursing board cannot do this alone in a manual way. So we need to integrate ICT into our processes.
Mm-hmm.
She told you from the beginning that we started with the first platform how to do it, the testing platform.
Mm-hmm.
Yes. Then we went back. I said, look, do we visited Ghana? We see what Ghana is doing, but let us develop a one-stop shop platform that will allow us to do one click and give us all the solution or results.
Mm-hmm.
So we are not just only having a one platform that only have to do with testing. We have a platform where we will sit and monitor school certificates. How many students are being enrolled at school while we are in office and we monitor that process,
Mm-hmm.
which you just explain how to do the indexing process. In that one platform again, let the students sit at home and work so wherever you graduate, you then will come to us to do registration. You sit
Because
where,
it's time consuming, you know.
yeah, we're talking. We sit wherever you want to do. You enter our platform and do your registration. The only time we want to see you is when coming to pick up your physical lesson and in a test hall.
Okay.
But all your transaction with all from your school whatsoever, we're doing everything
Online.
online. So that taking our work to be more effective and efficient as a military ballet.
She was talking about security. Obviously, you know about hacking.
Yeah.
How secure is the system?
Okay. Considering my background in the area of cybersecurity,
Mm.
and that also show I think we are giving tests for the past 4 year, and that showed our tests hadn't been leaked or outside there. I can boast on that my chair to say, look, we have 100% secure system.
Mm.
Look, but I say our system is well secure. We put in place every security system that will show that we are on path. And the system is developed is user friendly.
Okay.
Okay. Do we look at Ghana model and we develop a Liberian model? If you look at the Irish Ghana, majority of them are technology friendly. If you
Mm.
come to Liberia, we are a little bit technology friendly. So we develop the system in a way that looking at our environment
Mhm.
to consider people
You
to
say
get
usage.
yeah, still usage. So the system you develop is 90% automation and 10% human intervention. So human be able to do one or two, but you will see 100 to 50% result is coming out to you. So we develop it in a way that like, everyone can get access to that platform. As long you get used to your smartphone,
Mm.
you get access to our platform, e-city and what have you. We'll get a report feedback system. So you were using our system and you found something difficult, just give us a call. Within a second, we'll respond to you and we solve that problem. We are working with the school's IT, the IT system within those schools to see how best the students will be more friendly to our platform. So now that one-stop platform is now serving that capacity for our in terms of regulating nurses and midwifery institutions.
Mm. Let me come back to you, Madam Flomo. I mean, giving 23 schools, are they enough to train the kind of nursing population that the country demands? Or there should be more schools.
Actually, I won't say we need schools,
Mm.
but the current ones, they are like spread almost in all of the region.
Okay.
We have Bomi Community College. I didn't name Bomi Community College. So that entire region, people can benefit. The government has done well with these placements.
Mm.
So in the Southeast, you have like two there, the nurses and the midwife, Grand Chida and Maryland.
Mm.
You are right, we need more schools, but I usually tell people we need more quality.
Okay.
If we can emphasize that, we are good to go. In Morovia alone, we have them. Greater Vision is there. I didn't name around.
Oh, kind of. I think Panovi.
Yes, Panaville, Duja is there.
Mhm.
So what we would like to emphasize here is let's build the capacity of what we currently have in a very robust way to go according to standards. And I usually tell people we are in a global village. If you decide to implement, think globally
Mhm.
and act locally. That supports you and supports your sustainability. And that helps you to move around within the global world to be on par with standardization.
Mm.
So, yes, we will need school, or we do need, however, I like to say we need quality.
Yep. Okay, you're listening to the Super Morning Show on ELBC this morning. My guest, Madam Cecilia Okpangmara Flomo, is the registrar of the Liberia Board for Nursing and Midwifery. And also, Jipley Williams is the head of RT there at the board. We can take calls. So call us on 0770581886, 0770581886, and be live on the show this morning. We're discussing nursing, the practices of nursing and midwifery. I see a lot of, let me take this call first. Good morning.
Good morning, how are you?
I'm fine. What's the name?
My name is Dr. UJG Konga, and I call from Monrovia.
Yeah, let's hear you, sir.
Okay, thank you to your studio guests. They are doing so much well. Just want to extend thanks and appreciation for the work they're doing for the Liberian people. But I just got one concern.
Mhm.
My concern is that, and I was in Basel a couple of weeks ago, and then I had a conversation with the people there, and then the nursing directors there told me that there was a regulation from the board that said that there should be no doctors, there should be no PAs teaching any of the nursing programs, nursing and midwifery programs. It was a bit strange because it was my first time hearing it.
Mhm.
Taking into consideration the kind of quality they are talking about, is it just sufficient to have nurses, teaching nurses, and then we have the kind of quality?
Okay.
I had a little bit of problem because the students that came from the GBCC in Basel, when they came to the government hospital, we found out that they were far below the belt when it comes to their clinical practices. Basic things that we expected them to have known were far more less than what they could represent. So I just thought to flag it so that I don't know when the policy came out and why it was that policy
Okay.
made
She'll
that
respond.
only nurses to teach and not doctors and no PAs.
Okay, she'll respond to that. Thank you very
Thank
much.
You're welcome.
Thank you. So call us on 0770 581886, 770581886. Let's hear from this person. Morning.
Yeah, good morning.
Good morning,
I'm
sir.
Dolly. This is Fala Dolly calling from Jakarta.
Yeah, let's hear you, sir.
Yeah, okay. I listen to them. But what I want to get clear is that she's a chair. And looking at it, there are substandard nursing school all around. But I didn't really get her. What will she do to get rid of these people? Because you can just leave it and then you say, okay, because there are so many substandard and nurses and midwifery all around.
Okay.
Now, she must do something.
Okay.
That's my point there.
Okay. Thank you very much. Good morning. Good morning.
Yes, good morning, sir.
Yeah, you want to leave from the radio?
Yes, I did.
Yeah. Go
Yeah,
ahead.
please. I only had a very one concern. The concern is that
You didn't
most
call
of
your
the
name, Chief.
institution. My name is Anderson Chia,
Mm-hmm.
and I just came from River G.
Mm-hmm.
And most of the things that are always happening in central Liberia. What's about the southeastern areas? More especially River G. I'm concerned like Grand.
You said what is happening in Central Liberia?
I said most of their programs.
Oh, okay, their activities.
Yeah, so maybe
Okay.
if they have their plan to extend in most likely they do 2 counties.
Okay. Okay. Thank you. Thank you. Thank you very much. Good morning. Good morning.
Yeah, good morning, good morning.
Good morning. What's the name?
Yeah, this is John Flomo calling from Tupo Road.
Yeah.
Yeah, my question had to do with we have so many schools in Mosuralo.
Mm.
So in case I open my school and I have so many fake nurses coming up and they take the ID card to them, what would be the benefit of it?
The penalty or the benefit?
The benefit.
Oh, okay. 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 It's like you're reporting the crime, eh?
Yeah.
Okay. Thank you. Thank you. Thank you very much. We can take a call too and go back to our guests. 770581886, 0770581886, and be live on the show this morning. If not, then we'll go back to our guests. Yeah, you want to respond to some of the concerns, especially the ones that have to do with the one from Basa, where the students cannot live up to the expectation of the hospital and all that. Yeah.
I appreciate that quarter because you and I are just talking about standard and why it takes to producing quality product.
Mm.
And he has just called to give these, which I have taken serious note of, and we are going to take action about students performing below the standard. When it comes to teaching, our regulation or policy or standard requires that only nurses and or midwives teach the 5 core courses. In nursing, we have what we call the 5 big brothers or sisters. Those are courses that we administer the exam in. And we feel that nurses and midwives reproduce themselves more appropriately. Therefore, we embrace the interprofessional collaboration, but there are also areas we think nurses can perform. And that area is teaching the 5 core courses.
Mm.
So the requirement or the standard or the regulation require that we don't encourage other professionals to teach these 5 courses because we feel that nurses will teach it more, nurses will perform it more, and nurses will live it more. So if students are not performing, there are many factors, and we think that quarter we will take note of that and approach appropriately why the nurses are not performing. But for the teaching, only nurses and midwives are required to teach these courses.
Okay.
And the task force, they got a court about what are we doing about fake schools. He's right. We actually wrote before the Justice Ministry.
Mm.
And it's in the act. If someone who is not authorized to teach or present themselves that they are able to teach is a crime. So again, we will go back. We discuss these every time in our board meeting. Because even if you are a nurse and or midwife and you taught into an illegal school that is not accredited, you are at fault. And something should be done with you professionally. So we take note of those and we will go back and maybe start another high level collaboration, cooperation, and task force that will include you, the journalists, on how we can identify schools that are not to be in our society, how we can root them out. The ground crew, yes, but the digitalization will require that you, from your comfort, whether you are in ground crew or anywhere, you perform your services.
Mm.
So at least this is one of the objective, and this is one of the high benefit about us going and not physically, because he's right. Physically, you can't write at the office, you have to be in Monrovia. But online, on the platform, you can be anywhere. And for his information, we gave tests in the Southeast. We now take the exam as far as the Southeast, either in Grand Judea or Maryland. Just last month, we administer exams right on
Yeah.
Tottenham University campus. So we've been trying and we will wish to improve more. The CPD, the same way you can be anywhere and do your CPD. And the CPD dissemination, we did extend to the Southeast. And the person that called to talk about fake license and punishment and benefit, there is no benefit about getting fake license. All you get is discipline because you are breaking the rules.
Yeah, Jubilee?
Yes, in addition, you spoke on something about security, and I think you heard the registrar saying, making more details on that. The system is developed in a way that when you upload a fake document, we don't have to head ourselves. The
It will
system when you will detect that this is the fake document. I think the past time we were doing some check and column, we noticed that a lot of fake documents were uploaded. Students going to the World Trade Center because the system actually say, give all your birth certificate. The scene is so difficult getting birth certificate. They bring it, they go to World Trade Center and print the birth certificate. When you load it up to the system will detect this is a fake document. And even when you bring fake wire document, the system also detect this is a fake document. You ask a question, she told you that, like for example, school A, you wrote 10 students, and we believe for the next 3 years, at the end of the 3 years, the three we expected to be either 9, but shouldn't be more. Then what happens? Somebody leave from school B, and you wrote to transfer, and she mentioned something about identity card, which is a number, which is that index number. Wherever you go, every time you go to any schools, it will track you. So we expected 10 students, and we'll see 15 students. We'll see those numbers those students bring, which is the indexing number. It's okay. They keep from school E. They also track the system. The system is also developed in a way that when you enter the system, you can off your data. Again, manipulate the system. If you want to get command for the system to move forward, you put your data on. So we develop in a way both online and online. Yes, offline, online. We develop in because based on the kind of region we find ourselves in. So when a person you're taking the test online, do the test, you can off your data. After they complete their 100 questions they want to submit, you just put the data on it, just do the submission.
It will not have to start
all over. You don't have to start all over. So we develop a system in a way that because we are in Liberia, they assume that we are in where we are moving up.
Okay, that will be your parting comments, Jubilee. I will come back to you, Madam Flomo. Lastly, before we leave you, your parting comments.
Yes, our reform continues. Jubilee is currently working on a framework that will require all having what we call the student digital literacy program. Like he said, we noticed that our students, even though we have ICT in our curriculum, nurses and midwife curriculum, we still see that when our students come out, they face a lot of challenges in using our platform. So we will collaborate with the schools in how we can enhance this by using the student digital literacy program, which Jubilee is currently working on here in his team. Of course, accreditation within the next few years, 1 to 2, we will move strictly our accreditation online because that is part of the reform that the board has approved. And of course, we are currently working on what we call our data protection policy. The nursing board has started all of the digitalization, and we need that policy to guide the process.
Okay.
And I will quickly say, if it is my parting comment to the schools, to please implement the curriculum that are given to them, because that will be evaluated. We are developing what we call the student evaluation form. It will come strictly to the board. That will be online, the questionnaire. And the next evaluation will be your students' performance at the stable. Some school students perform very poorly at the school stable. And it made sure that the curriculum or curricula are not being implemented properly.
Okay, thank you very much. Well, she's Madam Cecilia Okpangmala Flomo, the registrar of the Liberia Board for Nursing and Midwifery. Also, you listen to Jubilee Williams, the head of RT, talking about digital reforms at the board. My name is Vafle Kamara. Join me tomorrow for another presentation of the Super Morning Show. Bye-bye.